Next, we're going to talk about cardiovascular and respiratory system disorders. Very common disease processes to see when we're in the nursing home. So when we're talking about cardiovascular disorders, we're talking about problems occurring in the heart or the blood vessels themselves. So we have those two phases of our heart. We learned about them when we were learning about vital signs. We have the systolic phase, or when the heart's actually contracting, and we have the diastolic phase where the heart's at rest and the heart's filling with blood. So your heart's going to fill with blood. It stretches that heart muscle out, and then it's going to come back and contract. So when we were learning blood pressure, for instance, we learned we had a systolic blood pressure, the amount of pressure that the heart's having to pump against when it's contracting, and the amount of pressure that's still there when the heart's at rest. So one of the first disease processes we'll look at is hypertension, and we've talked about this as well when we did vital signs. It is when the resting blood pressure is too high. So we are going to be using the systolic pressure being over 130 millimeters of mercury. The blood pressure is being 130 millimeters of mercury or higher, or the diastolic pressure is 80 millimeters of mercury or higher. And I know in your book it talks about how over 140 over 90 is considered high blood pressure. Unless they have a cardiac history, then they recommend 130 over 80. But through the American Heart Association, the American Cardiology Association, the American Stroke Foundation, they recommend using that value of 130 over 80. So this is caused by narrow blood vessels, kidney disorders, head injuries, pregnancy problems, and adrenal gland tumors. And those adrenal glands are part of the endocrine system, and they sit right on top of the kidneys. So some of the problems with hypertension is it can lead to strokes. It is one of the leading causes of strokes. What I should say is one of the biggest complications of hypertension is strokes. We also see hardening of the arteries, heart attacks, heart failure, kidney failure, and blindness. And the really difficult thing about this is many times hypertension has no warning signs whatsoever. The person has no signs or symptoms of any problems. Some people do, okay? Some people might complain of headaches, frequent headaches, or nosebleeds. Maybe they get a little dizzy or lightheaded sometimes. But as a general rule, a lot of people do not have any warning signs at all that this is happening to them. As a matter of fact, it's frequently known as a silent killer because people don't have warning signs that this is happening until they have a stroke or until they have a heart attack or they go into heart failure or kidney failure. So having your blood pressure checked routinely is very important. So lifestyle changes can lower blood pressure. So generally when a person comes into a doctor and their blood pressure is up, the doctor doesn't want to just immediately put them on medication. They'll usually say, okay, let's try a low-fat diet, low fat, low salt. Okay, salt makes you retain extra fluid, and that makes extra fluid your heart's having to pump through. So low-fat diet, low-salt diet. If you're overweight, they're going to try to help you, encourage you to get down to a normal, healthy weight. Regular exercise, not smoking, limiting alcohol and caffeine, trying to decrease stress and getting enough sleep at night is important. And then if that doesn't take care of it, if a person can't manage it with with lifestyle changes, then they'll add blood pressure medications into the mix with that. So we don't go off of just one isolated reading with high blood pressure. It's usually multiple readings over a period of time. Now, if a person goes in with high blood pressure and it's just off the charts high, then they might end up on blood pressure medication immediately. But for most people, we have them go home, we have them do dietary changes, lose weight, and then we have them come back and check their blood pressure. And if it's still high, we see what we may give them some more suggestions to try. We'll send them home and we'll check it again. And then if it's still running high, then they'll talk about adding medication. Now, the term coronary artery disease, CAD, coronary artery disease, the coronary arteries are the arteries that feed the heart muscle. So it's not that blood pumping through the inside of the heart. That's not how your heart gets its blood and oxygen. It's the coronary arteries that wrap around the outside of the heart muscle. That's what actually brings blood and oxygen to the heart muscle. So over a period of time, the coronary arteries can become hardened and narrow. And so the most common cause is atherosclerosis. And atherosclerosis is a buildup of fat and plaque that happens in the arteries, and it causes that narrowing or that constriction of the blood vessels to the heart, so not as much blood and oxygen get through. So when a person has artery disease, coronary artery disease, they have angina. And angina is a fancy word for chest pain. They might have an MI. It's a myocardial infarction, also known as a heart attack. They may have irregular heartbeats, and they may just go into sudden death where they just quit breathing and their heart quits beating. So the more risk factors a person has for coronary artery disease, the more potential chance they're going to have of having these complications of it, and need more assistance. So the term angina is chest pain. It means chest pain, and it happens from a reduced blood flow to part of the heart muscle. So the heart muscle is called myocardium. Myo is muscle, cardium is heart. So it's a reduced blood flow to the heart muscle itself. And some people describe it as a tightness sensation, a pressure, a squeezing, or a burning in the chest. And a lot of these times symptoms can be relieved. Sometimes just rest will relieve the symptoms. If not, they usually take a medication called nitroglycerin. It's a medication that they stick under their tongue. They can either spray it or use a tablet under their tongue, and it dilates the arteries to the heart to allow more blood and oxygen to get to the heart muscle. And some people actually wear nitroglycerin patches. Things that cause angina are avoided, and they usually will also get supervised exercise programs. Now, if they start having chest pain and it's not just lasting a few minutes, it's not being relieved by nitroglycerin, they may actually be having a heart attack. And so then we're going to always tell them to try to call 911 and get them help. So the term heart attack, the fancy name for it is a myocardial infarction, also known as an MI, and that's when part of the heart muscle dies. Now, it doesn't mean that the entire heart quits beating. It means that, so let's say your coronary arteries that wrap around the outside of the heart muscle, if one of them is plugged off with coronary artery disease and the atherosclerosis, that narrowing of the artery there from fat and cholesterol buildup, and this part of the heart muscle doesn't get blood and oxygen, that part of the heart muscle can die. That's a heart attack. The rest of the heart may be able to keep beating, or it may stop suddenly. So it can go either way depending on what part of the heart's affected and how big of an area of the heart is affected. So the term MI, or myocardial infarction, is also known as a heart attack, an acute myocardial infarction, acute coronary syndromes, a coronary thrombosis, a coronary occlusion, but usually a heart attack or an MI is what you're generally going to hear it referred to as. So this is kind of an example. So here I've got narrowing of the arteries, which wrap around the outside of the heart muscle. And if blood and oxygen can't get through that, then this part of the heart isn't going to get enough oxygenation. And if the tissues don't get oxygen, the tissues are going to start to die. So that's what a heart attack is. Now, the other thing that can happen is if you've got all this fat and cholesterol buildup right here, a blood clot can actually start to form there and block it off completely. So what they like to do is they want to get this person into the hospital as soon as possible, and they take them to what's called a heart cath room, or for a heart catheterization, and they go in and they can put an instrument in here, and they can actually push that plaque up against the wall to allow more blood flow to get through, or they can actually grind up the plaque if they need to. And if there is a clot there blocking it, they can actually give them some medication that will dissolve that clot. So there's a lot of things they can do if the person comes into the hospital right away. But that's why when people are having warning signs or signs and symptoms of a heart attack, we don't want to ignore it. We want to just make sure that they get into the facility as soon as possible. So our treatment, we want to relieve the pain. We want to restore blood flow to the heart. We want to stabilize vital signs, make sure oxygen levels are good, calm the person, and try to prevent any life-threatening problems. If the person survives, though, they may need medical or surgical procedures to open up that blocked artery, and they might even need open heart surgery where they bypass the diseased vessel. And then cardiac rehabilitation will generally need to be used. So what are some warning signs of a heart attack? Because heart disease is the #1 killer in the United States for men and women. So recognizing some of the problems a person can have, some of the symptoms they might be having. So chest pain. Now, some people describe it as a squeezing sensation, a pressure, a heaviness. Some people say it feels like indigestion. Some people say it feels like an elephant sitting on their chest. The discomfort may go to other areas, so the symptoms may include pain or discomfort that travels to the neck, to both arms, through to the back. And so that's called radiating pain, pain that's in one area of the body and it's traveling to other areas of the body. Shortness of breath. So this is a feeling that often comes before chest discomfort, or it may accompany the chest pain where the person just feels like they can't catch their breath, that they're not oxygenating well. Nausea means sick to their stomach, like they might throw up. Dizziness or lightheadedness. A lot of people will complain of feeling cold and clammy or lightheaded while this is happening. And we want you to help them they need to get help. So we try to encourage people to call 911, not to drive themselves to the hospital. If we're in the nursing home and a person's having a heart attack, we'll let the nurse know, and the nurse will generally call 911 and they'll have an ambulance come and get them and take them back over to the hospital. We can sit them down, we can make them comfortable. If they're in the nursing home, the nurse will probably, if they have nitroglycerin ordered, they'll bring them nitroglycerin. If you're at home, if you're like out in the community and someone's having a heart attack, they'll also may tell you to have the person take an aspirin, a chewable aspirin, if the person doesn't have an allergy to it, because that can dissolve the blood clot that's blocking that artery and help get more blood flow to the heart. So the American Heart Association goes by what we call the chain of survival. And that means when a person's having heart issues, we want early access to help. Call 911. Early CPR, if their heart stops beating, we are going to need to do compressions and do CPR. Early defibrillation, if we have access to an AED, and early advanced care, of medications and more definitive treatments. Now, the term heart failure is also known as congestive heart failure. Heart failure is the most correct terminology for it, but it used to always be referred to as congestive heart failure, so it's frequently still referred that way. And with heart failure, it occurs when the heart is weakened and it can't pump blood normally. So the person is having, their heart is diseased, the heart muscle itself, the myocardium, and usually it happens a lot of times when people have had heart disease and the heart tissue starts to kind of scar and change its conductivity, its ability to stretch and come back and contract. So the heart muscle has weakened and it doesn't stretch and come back and contract, so it doesn't pump normally. So if it's left-sided heart failure, so remember your left side of your heart pumps blood to the body. If it's left-sided heart failure and the left side of the heart can't pump blood normally, things start backing up into the lungs. If it's right side of the heart that can't pump normally, and the right side normally pumps blood over to the lungs, if it can't do that, then it's going to back up into the venous system and it's going to back up into their body, and you're going to see edema in their legs and swelling. And if they have severe heart failure, it may be right and left sided. So they have the shortness of breath, fluid backing up in their lungs, and fluid backing up into their body. So a healthy heart, the heart muscle is good. The heart can stretch and come back and contract. An unhealthy heart, when the heart loses its ability to come back and stretch and contract, the heart starts enlarging. It becomes very big and very large because it can't effectively pump anymore to get the blood out of it. So it gets almost kind of boggy or mushy, I guess is a good word for it. So what causes heart failure? Heart disease, heart attack, high blood pressure. It's more common as you get older. Diabetes puts you at risk for it. Irregular heart rhythms puts you at risk for it. Damaged heart valves you have valves inside your heart. Those, if they're damaged, can put you at risk. And kidney disease. So how do we treat a person with heart failure? Well, there's medications that they're on quite a few medications, but they will give them medications, one, to strengthen the beat of the heart. They actually have medications that will strengthen that force of that contraction. And then they usually will also give them medications, diuretics, to get rid of the extra fluid that's in the body. A sodium-controlled diet, because again, sodium makes you retain fluid, and we don't want that. We want the extra fluid to get out of the system, so they're usually on a low-sodium diet. And remember, low-sodium diets, if you're in a hospital, they'll actually order 1,500 milligrams of sodium a day. If you're in a nursing home, it usually is NaS, no added salts. Semi-Fowler's position is preferred for breathing. People will usually breathe better when they're in a sitting up position. And the person must reduce their risk factors for heart disease, lose weight if they're overweight, decrease stress in their life. All those risk factors we were talking about for, we weren't talking about risk factors. We were talking about signs and symptoms. We're going to talk about risk factors for heart disease and for heart failure here in just a sec. And if they're acutely ill, the person will actually need to be hospitalized. So our risk factors for heart disease. Risk factors are habits or characteristics that predispose you, to getting that disease process. So when we're talking about risk factors for heart disease, these are things that are going to predispose you to having heart disease, heart attack, chest pains, hypertension, and heart failure. And the more risk factors you have, the more likely you have of developing these disease processes. So having one risk factor isn't great, but having two is worse, and having three is even worse. So high blood pressure, we talked about it as a disease process, but it is also a risk factor for other heart issues. So again, we want high blood pressure makes the heart work harder than normal, causing it to weaken and enlarge over time. So high blood pressure, as I mentioned, frequently has no symptoms, but many times we can control it with diet, with exercise, and with medication. Smoking. A smoker's risk factor for heart disease is double than that of a non-smoker. So if a person smokes, we really want to encourage them to quit smoking. The nicotine and the carbon monoxide reduces the amount of oxygen in the blood. It increases that atherosclerosis, that fatty plaque stuff that builds up in the arteries. It causes that to grow faster. It can trigger clot formation, so your heart starts clotting and your blood kind of thickens and clots. It reduces, I don't know if you remember when we talked about nutrition, we have bad cholesterol, we have good cholesterol, and we have really nasty cholesterol. Well, it reduces the good cholesterol. It raises the bad, and it reduces the good. And it can make the heart beat irregularly. So we really want to encourage our residents and our patients to not smoke. High blood cholesterol, so that atherosclerosis is the buildup of fat and cholesterol in the arteries. And cholesterol can build up in this, so when the cholesterol does build up inside of those arteries, causing them to narrow, that's what atherosclerosis is. And high cholesterol doesn't have any symptoms until it actually causes a problem. So it's really recommended that you get your cholesterol levels checked when when you're going in for routine visits to the doctor. After you get to a certain age, they should be checking your cholesterol levels. Physical inactivity. You guys, it only takes 30 minutes a day of a moderate exercise. And even if you have a hard time finding time to exercise, if you just find like little 10-minute increments here and there, it will benefit your heart. But before starting an exercise program, you really should get the doctor's okay if you already have a heart condition. People that are obese and overweight, it puts you at a much higher risk of heart disease. So we recommend a low-fat diet. We recommend healthy eating. And the other thing with being overweight is as far as the shape of how you're overweight. So if you are pear-shaped, and what I mean by pear-shaped is your stomach, your abdomen is bigger than your chest. That is considered an apple shape. A pear shape is when your hips and butt are bigger than, your chest area and your stomach. So if you put your weight on in your hips and your butt, that would be pear shaped. If you put your weight in your abdomen, you're apple shaped. And apple shapes have higher risk of heart disease than pear shapes. So overweight in general is not good for your heart, but especially if you're putting it all on in your abdomen. And just losing 10 to 20 pounds can significantly reduce your risk of heart disease. And diabetes. Now we talked, diabetes we'll talk about when we talk about gastrointestinal diseases and endocrine issues, but diabetes is a disease in which the body doesn't make insulin anymore, or it doesn't respond properly to insulin. And diabetes has been linked to heart disease and blood vessel disease. So it's extremely important for diabetics to eat properly, to exercise, and to maintain a normal weight and take medication if needed. Poor dietary habits is also a risk factor. So healthy food habits can help reduce blood cholesterol, can help you reduce high blood pressure, can help with obesity, and thereby decrease your risk of heart disease. So the American Heart Association recommends you eat a variety of fruits and vegetables, at least 5 a day, eat whole grains, eat fish at least twice a week, choose fats and oils low in saturated fats. And remember, the saturated fats are usually solid at room temperature. Your unsaturated fats are usually liquid at room temperature. Limit your high-calorie foods, eat less salt, and limit your alcohol intake. And then stress. You guys, constant stress is unhealthy. And I know it's hard, especially when you're in school. And a lot of you, you're going to school and you're raising your kids and you're having to work. It's very stressful. But constantly feeling stress, it creates an unhealthy response in your body. When you're stressed, you release cortisol and adrenaline in your body, and it causes a reaction in your heart. So you need to learn healthy ways to deal with stress. Whether that's meditation or exercise or good friendship, but you need to make sure you're finding ways to decrease your stress that are healthy. So those are risk factors for heart disease. And granted, there are some we can't change. As we get older, we're at more risk for heart disease. We can't change that. Genetically, African Americans are generally more prone to heart disease than Caucasians. You can't change that. Your family history, if you have family history of heart disease, you're going to have a higher tendency or higher risk for it. You can't change that. So the things you can change, you want to make sure you do. So how we help with someone who has heart disease, we need to promote rest. We need to make sure that when we are doing activities with them, that we give them periods of rest in between. Measure intake and output, especially our heart failure patients. They're taking diuretics, those medications to excrete extra fluid out of their body. We need to make sure that they're actually excreting that extra fluid out. We weigh the patient daily. So with heart failure patients especially, we tend to weigh the person every day to make sure they're not retaining too much fluid in their body. We check a pulse oximeter with vital signs, so that oxygen saturation that we talked about, and normal is 95 to 100. Some places use 94 to 100, but it's 94, 95 to 100. Restrict fluids if they're a heart failure patient. Follow diet orders. Range of motion and other exercises as ordered. And then a lot of times we'll do those elastic stockings, those compression socks that we've talked about in other classes. It helps fluids from just building up in those lower legs. It helps keep it going back up into the main system. Now, another thing that can happen with patients with heart disease is they can have what we call dysrhythmias. And your heart rhythm is the pattern, it's the electrical signal that your heart makes. Your heart has electricity that goes through it, and it actually can transmit to a heart monitor a signal or a pattern. And a dysrhythmia is when that signal or pattern is not, it's disrupted, it's not beating correctly. So the heart can beat too fast, which would be a tachycardia, too slow, which would be a bradycardia, irregularly. Remember, we talked about when we're doing vital signs, we want to check the rate, and we also want to know, is it regular or irregular? So the heart can beat irregularly. So there are medications that can happen. Sometimes when people have a lot of irregularity, they might need an ablation. If their heart, it becomes super irregular and they actually quit breathing and their heart stops beating because of it, we can do defibrillation. So respiratory disorders, the respiratory system brings oxygen into the lungs and removes carbon dioxide from the body. So respiratory disorders interfere with this function and can threaten life. Okay, so your respiratory system, you breathe in your your air goes into your lungs. Your heart's going to send blood over to those lungs, and it's going to surround those alveoli, those little air sacs, and through osmosis and diffusion, that air you breathe in is going to go into the blood supply to be carried back to the heart, to be pumped to the body. Your waste products, your CO2, you're going to exhale off. But if a person has respiratory issues, so a really common one is chronic obstructive pulmonary disease, or COPD. And COPD is chronic bronchitis or emphysema. So the number one cause of COPD is cigarette smoking. Number one cause, cigarette smoking. And cigarette smoking, pipe, cigar, and other smoking tobaccos can do it. And the next common cause is going to be exposure to secondhand smoke or exposure to pollutants, okay, chemicals and pollutants that damage the lungs. So not smoking is the absolute best way to prevent COPD because it absolutely has no cure. And it affects the airways and the alveoli and is going to keep that oxygen and CO2 exchange from happening properly. So with chronic bronchitis, which is one of our COPDs, it occurs after repeated episodes of bronchitis. The term bronchitis means inflammation of the bronchi. And again, smoking is one of the major causes. So infection, air pollution, industrial dust are also risk factors. And a lot of times people will have what we call a smoker's cough in the morning. So first thing in the morning, it's like, and they're just hacking all the time. So the best treatment is going to be to just stop smoking. Now, a lot of these people will need oxygen therapy, breathing exercises. We want to try to prevent them from getting respiratory tract infections, but the biggest treatment is going to be to stop that smoking. So this is showing you the bronchial tubes, normal bronchial tubes, how big and wide they are. But when they get inflamed, when you have a chronic bronchitis and they get inflamed, they swell up here. So the airways swell up, and then mucus and stuff starts forming, and it plugs it up even more. And it's really hard for that exchange of oxygen, of air and oxygen to happen. Emphysema, our other COPD we were talking about, is when the alveoli enlarge and it becomes less elastic. So they can breathe air in, but they have a hard time. It gets trapped in the lungs. They have a hard time exhaling the air out. Again, smoking is the most common cause. Air pollution and industrial dust are also risk factors, but the person will frequently feel short of breath and have a cough. And generally, breathing is going to be easier for them when they're sitting upright and slightly forward. So a high Fowler's position, or there's the position that we call the orthopenic position, where they sit and lean forward over their table, and they're actually just leaning forward and sitting this way over the table. That is a really common position to see them in. So really important that this person quit smoking, and they will frequently need breathing treatments, breathing exercises, and oxygen, and potentially inhalers to help them be able to have a good air exchange. So here is what your normal alveoli look like, those air sacs. And with a person with emphysema, they stay super inflated with air. People can get air in, they just cannot get it exhaled out. So what happens is the chest actually starts enlarging, and they get what we call a barrel chest. So their chest actually starts enlarging because they're always having trapped air in there. And after a period of time, normally your respiratory drive is based off of your oxygen level. If your oxygen level goes down, it's going to tell you need to breathe more. But with a COPD patient, after a while, their respiratory drive is going to go off their CO2 levels. So if we start giving this person high doses of oxygen, giving them too much oxygen, more than what their body can use, it's going to actually their oxygen levels are going to increase. It's going to decrease their CO2 levels, and they're going to lose their drive to breathe, and they can quit breathing. Asthma is when the airways become inflamed and narrow, and extra mucus is produced. So again, normal airway. Here it's inflamed and narrowed, and then a bunch of mucus has built up in it, and it's really hard for a person to breathe. I mean, try breathing through a little tiny straw. I mean, that's kind of what they're having to do. So they feel short of breath. They're having difficulty breathing. That's that word dyspnea. DYS in front of the word is difficult. Pneumonia is the root word for breathing. So dyspnea, wheezing and coughing, pain and tightening in the chest. And asthma is frequently triggered by allergies, So sudden asthma attacks can occur, and usually we will treat them with medications. The person will have respiratory treatments. We can actually give them medication to kind of open the airways up a little. Now, sleep apnea is when the person has this pauses in breathing during sleep. So usually it's caused by a blockage of the airway, and we see it a lot of times. A really common risk factor for it is being overweight, because people, people are really large waist, they're overweight. It's hard for their diaphragm to pull down to bring in good airflow. So signs and symptoms are pauses in the breathing. I mean, it just sounds like they quit breathing for a period of time. Really loud snoring. They wake up gasping. They have problems staying asleep. Headaches in the morning. Sore throats. So they have a machine called a CPAP machine. It's a continuous pressure airway, or continuous positive airway pressure. It basically forces air down into their lungs. So people, when they're sleeping, they wear this mask over their face, and it actually pushes air down into their lungs. So they're not so they don't go through these periods of not breathing when they're asleep. Influenza. Now, we made you guys get an influenza shot to be in our program, but influenza is a respiratory infection. It's caused by viruses. And so generally the flu season is from, well, we used to say November to March, but really more October to March now is when our flu season is. Most of the deaths that occur from the flu happen in our elderly population. So we can do supportive care. We can treat with fluids, rest, relief of symptoms. If they start an antiviral medication right away, it can cut down a few days of the symptoms. But coughing and sneezing tend to spread the flu virus, and the flu vaccine is the best way to try to prevent the disease. Now, the problem is it doesn't prevent it all the time. The influenza virus constantly changes. It constantly changes. So what is considered, what the flu virus is this year, next year it's going to mutate a little bit. It's going to change a little bit. So when they're developing the vaccines, they're looking at what they think is going to happen with that flu immunization. They don't always get it perfect. So sometimes you get a flu shot, yes, you can still get the flu. We realize that this still happens. But generally, people that do not get the flu immunization have there's much higher death rates than the people that do not get flu immunizations. And most of the time they get it right, at least with some of the strains of the flu. So, keep that in mind. As a healthcare provider, you will be expected to get a flu immunization every year. Some facilities that you work at will not let you work there unless you get a flu immunization. So the influenza causes headaches, fever, muscle aches, joint aches, you might have vomiting, coughing, sore throat, runny nose. All of that is considered the influenza. And then pneumonia, very common in our elderly population. It is an inflammation and infection of the lung tissue. The affected tissues fill with fluids. It can be caused by bacteria or by viruses or other microbes. And usually the microbes reach the lungs either by being inhaled, by aspirating. I mean, we've talked about aspiration pneumonia. When you have someone who has dysphagia and they inhale food or fluid down in their lungs, it can cause a pneumonia, or it may get carried in the blood. Generally, it's more common in children under the age of 2 and adults over the age of 65. And our older adults are at the greatest risk of dying of this disease. So when we have dysphagia patients, we need to be very, very careful with them. And there is a pneumonia vaccine, and usually they will give it to people in the nursing home. They do recommend it of people usually over 60 years of age to get the pneumonia shot. Now, factors that increase the risk of pneumonia: smoking. If you're a smoker, it's going to increase your risk. Aging, as we get older already, we said that's an issue. If you've had a stroke, because a person who's had a stroke, if they have any weakness or any residual weakness, they don't take quite as deep a breath. If they're on bed rest, when you're on bed rest, and you're not moving, you are not breathing as deep as when you move around. Immobility, chronic diseases, and people with tube feedings are more prone, because we said with tube feedings, things can regurgitate back up that stomach, up that tube, and then they can aspirate on it. So when people do have pneumonias, we're usually giving them drugs for infection and pain. We want to increase fluid intake to treat fever and to thin the secretions so they can cough them out easier. They might get IV therapy and oxygen therapy and at least a semi-Fowler's position to ease breathing. Rest is important. Standard precautions when we're caring for these people are important. And as far as isolation precautions, it would depend on what's causing the pneumonia. But the other thing that's really important is good mouth care, because what we have found is that when people have poor mouth care, and then if they do aspirate something, there's more bacteria in with it when they aspirate, and that can cause a pneumonia more. So good mouth care is really important. Frequent linen changes are needed because if they've got a fever, and they're sweating a lot, they might need more linen changes. And then tuberculosis. Tuberculosis is a bacterial infection of the lungs. It also can occur in other parts of the body. You can have tuberculosis attack the kidneys, the bones, the joints, and the nervous system. We tend to think of it just something that's in the lungs, but it actually affects other parts of the body. And if it's not treated, the person can die. It is spread by airborne droplets, so this person needs to be on airborne precautions. Risk factors include living in close, crowded areas, older people, poor nutrition, and people that have HIV. There is a type of tuberculosis that breaks out in our HIV community as well. So they tend to have appetite loss, fatigue, which is feeling excessively tired, chest pain, coughing up blood or a productive cough, night sweats, really pale. It can present in the body but not cause signs and symptoms and still be transmitted to others. That's kind of the dangerous thing with it. So usually they test it. They can do skin testing, but usually once they think a person's been exposed to it, they're going to need chest x-rays to see if it's been attacking the lungs. There's multiple drugs that we give for tuberculosis. Unfortunately, it's usually a variety of pills. There's usually 3 of them that we give, and they usually have to take them for a full year, and that's kind of hard to get people to buy into, especially when they start feeling better. They will need isolation precautions, airborne isolation, which means an N95 respirator mask, a gown and gloves the whole time that you're in there, and they need to be in a private room with a HEPA filter that will circulate the air. Respiratory etiquette is essential. So respiratory etiquette, covering their mouth when they sneeze, throwing their Kleenexes away, hand washing after contact with sputum or contact with them, very important. The term lymphedema is a buildup of lymph in the tissues. It usually causes pain and swelling. And so we see lymphedema sometimes with cancer patients or really bad infections. Sometimes if the person's had a surgical removal of the lymph nodes, so for instance, when a person has cancer, sometimes the lymph nodes right surrounding it have been potentially exposed to that cancerous agent, so they'll remove them, and so then swelling and edema tends to happen in those areas. So elastic bandages, exercise, good skin care are important. And we will stop there with our cardiovascular